Okay, the pamphlet that I created was for the disability oppositional defiant disorder, and that is abbreviated ODD. I created a little table of contents and then went right into some of the defining features and characteristics. ODD is not typically seen right away. It's something that starts to appear later on as a child develops, more towards ages of 2 to 3. And that is because their behavior starts to increase to where it's interruptive of their normal daily schedule functioning, and begins to inflict on their relationships and activities with family and at school. Some of the signs and symptoms appear in 3 different categories: anger and irritability, argumentative and defiant behavior, and vindictiveness. Often this can look like a child losing their temper really easily, actively refusing to comply with requests from adults or follow rules and expectations at school, deliberately trying to annoy or pick on siblings, and then could even be blaming others for their mistakes or their misbehavior. ODD expressed across the developmental categories typically begins right around the ages of 3 to 4. So the behavior, according to the DSM-5, has to be existent for at least 6 months. So typically this doesn't occur until the child's around 3 to 4 years old. It's not typically diagnosed in early childhood, younger than that, just because those symptoms are often also a part of normal early development. So often this can look in a child like being having a heightened sensitivity, being touchy, easily annoyed, maybe rigid, demanding of their siblings, more frequent, prolonged temper tantrums, or have difficulty soothing and engaging in excessive power struggles. So more in the sensory and social emotional areas, and that continues through the ages 4 and 5. Also heightened temper tantrums, emotional outbursts. These behavior changes, those start to begin to be more deliberate and more purposeful as far as disobeying the rules, and usually has negative effect on the child's ability to create relationships with their peers. Some services typically that can be used and developed are techniques like parent management training to help parents and others, individual psychotherapy, family psychotherapy, and then different problem-solving teams, and possibly even a comprehensive evaluation at school. Parents can help by building relationships with and building on positives, giving positive praise, prioritizing and setting reasonable goals, and reinforcing consistent behavior. Some cultural implications can occur when different families have different expectations of behavior, and so this can often create attitudes towards mental health and cultural differences in responding to child's problem behaviors, as well as the efforts to accurately assess the child and provide effective treatment. These are some of the resources that I included for parents and family members, and then I have references on the back.